The second study that we did was an epidemiology study of the prevalence of pain in pediatric patients. And so we used a health insurance database that had 25 million pediatric patients in it and looked for a variety of conditions associated with pain. So surgeries, traumas, genetic conditions associated with pain like sickle cell anemia, cancers, and other conditions that we know are associated with pain and in adults are often treated with analgesics. And so we looked at the prevalence of those conditions in the pediatric patients over 4 years, and we also looked at how those kids were being treated. And what we found is that conditions associated with pain in kids are relatively common. Over the course of 4 years, about 10% of kids will have some kind of painful condition. Now, most of the time not something chronic, it'll be a fracture or a sprain or abdominal pain, but some of them did have chronic long-term pain. The treatment patterns in pediatrics were much, much different than what we've seen in adults. Less than 50% of the kids received an analgesic, so that's an opioid or an NSAID, even after surgeries or fractures. There was a lot more use of non-analgesic treatments, so topical treatments, creams, anticonvulsants, muscle relaxers. That was more common, but still not common. And the duration of use of the treatments was actually very low in pediatric patients. Of those that got opioids, for example, 97% got them for less than 30 days. And those who got them for longer were patients with severe cancer, for example, end-of-life care, that sort of thing. So what we saw really was just that the prevalence of pain in kids is relatively high depending on the type, but the prevalence of chronic pain is pretty low, and that a lot of kids aren't receiving any kind of treatment for their pain.